Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Ashish Kabir of Hamilton Physician Group in Dalton. Dr. Kabir is a neurologist at Hamilton Physician Group-Neurology. He and Dr. Juan Gonzalez diagnose, treat, and manage issues related to the brain, spinal cord, nerves, and muscles. They specialize in the care and treatment of Alzheimer's disease, Parkinson's disease, seizure disorders, migraines, carpal tunnel syndrome, and strokes. Today, Dr. Kabir will be talking with us about the mechanism of Alzheimer's disease. Dr. Kabir, how does Alzheimer's disease affect the brain?
So it is quite the question that affects so many families now. So I'll try to give you our understanding of what we think is going on as we try to unravel these complex brain changes. So what happens is changes in the brain that begin maybe a decade or more before symptoms appear lead to typically the patient seeking some care. So during these very early stages of Alzheimer's, what we start seeing is toxic changes that begin to appear. Typically, this involves abnormal buildup of protein that might form what we call amyloid plaques and tau tangles. These are typically proteins that cause otherwise healthy cells to die. And the proteins otherwise are actually normally there. They're not abnormal proteins from somewhere else or anything, but what it is they usually either change conformation or become toxic to the cells. And as a result of this, these brain cells die. They lose connections with other brain cells. And as time passes, they become a part of many other complex brain changes as well. The damage initially takes place in Alzheimer's disease in particular in a couple of areas called the hippocampus, the amygdala, and the entorhinal cortex. And what these parts do is they're essential for forming particularly short-term memory. As the brain cells die or neurons die, additional parts of the brain start to become affected. If you look at an MRI or something of the brain starts to look smaller and it looks like it shrinks. And by the final stages of the disease, the damage is widespread and it's actually difficult to figure out what started first. But if you look at the brain, it looks significantly shrunk.
So it actually does shrink?
It does. We, get a lot of this information from autopsies of patients who have died at various stages, and that's when we look at their brains under slides, and that's where we get some of the stuff from. And yeah, by volume, the brain itself does shrink.
Wow. Now, are there early signs of Alzheimer's disease?
Yes. So as a type of dementia, there's loss of thinking, remembering, reasoning skills, and when they start to interfere with a person's daily life and activities is usually when people notice. It's the most common cause of dementia among older people. So it's oftentimes people write it off as, I'm just getting old, etc. But this is more than that. This is someone who a year ago was able to do certain things that the same task they couldn't do, a little while later. And typically it tends to be more complex tasks such as driving and things like that get affected first. But, what you notice are the memory things that we talked about earlier, like, family members' names that you should be familiar with or friends or locations, things like that. Yeah.
You start forgetting things that would normally be just right there in front of you all the time.
Right.
Yeah, I understand. What are some of the stages? Are there stages in Alzheimer's disease?
Yes, yeah. So we typically divide Alzheimer's based on how you're doing clinically. By that I mean the preclinical stage or early Alzheimer's can actually have very few symptoms at all. It's what we would call mild Alzheimer's disease. And then there's moderate and severe. During the preclinical stages, people are symptom-free, but the toxic changes that we talked about earlier have actually already begun. And they may show some of the signs that we talked about memory issues and things like that. But generally, these patients are typically very functional. They are able to go around their day. They just sometimes get frustrated that it's not as easy for them as it used to be. As the disease progresses to the middle and more severe stages, you start having problems recognizing family and friends. Eventually, we start noticing in the later stages inability to communicate. Sometimes there's neuropsychiatric manifestations, so, mood changes, things like that. Patients may forget to eat, sleep properly, and have trouble swallowing, and now it's gotten very severe at this point.
Now, what are some of the causes? If we know of the causes of Alzheimer's disease, what are some of those?
Well, we certainly think that there's a lot of underlying pathology that we still need to figure out. But as far as we know, as far as we've been able to, we're pretty sure at least about a couple of things. So in people with early onset Alzheimer's, there's genetic mutations that probably contribute to some of these changes that I'm going to talk about in a second. But late onset Alzheimer's probably is a more complex series of brain changes, and these occur over decades. So the causes include genetic, environmental, lifestyle factors, and the importance of these factors varies in terms of increasing or decreasing the risk of developing Alzheimer's. And in person to person, you really can get very different manifestations within the same family. You might have people in the same family that share the same sort of very complicated history of Alzheimer's, but they might be very different in terms of who gets what.
Which is part of genetics.
It is part of genetics, yes. So I think what that actually goes to say is how much the environment and diet and exercise, things like that, contribute to the progression of the disease. But we do know for a fact that some of the changes that we see include what we call plaques, tau tangles, and some biological features. And what these are, what I was talking about earlier about changes at the brain cell level. So there is injury to those brain cells that we can see. So we have new imaging techniques and new pathology which allow us to see the development and spread of these abnormal changes, in particular two things called amyloid and tau, which we can see without the person having to, pass away first. So we can actually image the patient to see these changes. And what we can do is, if we can start identifying the disease earlier with imaging, which we've been able to do more and more now, we can collect fluid to confirm our diagnoses and obtain imaging of different types to confirm our diagnoses to make, figuring out the disease a little bit earlier. So we do want to know why this disease tends to affect older adults more, but there's a lot of research that's happening to try to explore this question. We know for a fact that certain diets have been proven to slow the progression of the disease and delay the onset. So these are very important to bring up with patients who have strong family histories, for example, right? So if you say, you don't have any signs right now, but you have this very strong family history, maybe you might want to consider a Mediterranean diet or something along those lines because, this may make a substantial difference as to whether or not you develop those same brain changes.
That is a wonderful thing to know.
I think it's very, very exciting to be able to modify someone's disease course early on, right? You really give them that quality of life.
Now, Dr. Kabir, I know you treat patients with Alzheimer's disease. Can you tell us what treatments are available today?
Yes, and this is the exciting part for me, of course. There's no cure yet for Alzheimer's disease per se. There's nothing that reverses the changes in the cells that are already there, but the FDA, the Food and Drug Administration, has approved several drugs to treat the symptoms of Alzheimer's disease, and some of these have been approved for many years. More recently, we are definitely looking at medications that slow the progression of Alzheimer's disease too.
So there are those medications.
So we definitely have at least one medication that the FDA has approved to try to slow the course of the disease. And what this does is actually target the underlying pathology, some of those tangles and proteins that we talked about. We'll definitely be getting into that a little bit more, but for years, what's been available is medications to control the symptoms. Most of my patients really like these medications. They're very clean, typically, from a side effect perspective. And what they can do is they can not so much reverse the pathology that's happening, but they can clinically improve outcomes. Your concern is memory issues. Your memory doesn't get worse quite as fast, if that makes sense.
That makes a lot of sense. What about new treatments that are on the horizon?
Yes.
Maybe things that we haven't seen yet.
Yes. So we are targeting the buildup of this abnormal proteins, and we're always looking at anything that we can target from a genetic perspective as well. But as far as the buildup of the proteins, there is a drug that recently got approved, and there's a number of other drugs in the pipeline that the FDA is studying so that they can be classified as both safe and effective in reducing the progression of the disease. It is very different in many patients. From one patient to another, this disease can be very different. And so what you want to do is make sure that you're prescribing something that's going to help a broad section. You've identified those patients properly, and and that the benefits of the treatment outweigh the risks. So we're working on that.
What about treatment for the behavioral aspects of Alzheimer's disease?
We definitely have a number of available treatments for this that are very effective. Medications address sleeplessness, wandering, agitation, aggression, and we are working on trying to understand why these symptoms occur in this patient population. But behavioral modification is very important too. You may have heard the term sundowning, which is, where older patients who are not used to location changes do worse when the light goes down. When you come in a dark place, you might have visual problems as well, and you don't know where you are. It can worsen agitation, and addressing those kinds of exposure changes can make a big difference as well.
Well, that's all encouraging information. Thank you so much for joining us and sharing this great information with us today. Before you leave, can you leave our listeners with a word of advice when it comes to Alzheimer's disease?
Absolutely. I think the most important thing to remember is that identifying the diagnosis really does open up a world of possibilities in terms of slowing the progression of the disease, addressing symptoms that are available, and really improving quality of life. So really, this doesn't have to be as disastrous as it has been even 5 years ago. We're just really excited to be able to offer all these options for our patients.
Thank you, Dr. Kabir. For more information or an appointment at Hamilton Physician Group-Neurology, call 706-275-6121 or visit hamiltonhealth.com/neurology. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.